Hi, my name is Jessica Bettendorf, and I will be showing you a presentation on prostitution, primarily streetwalkers. I will be discussing the history and background, the state laws, the overview of risks. I will be talking a little bit about pimps, gender differences, reasons why prostitutes engage in prostitution, and clinical implications. So, prostitution is defined as the performance of sexual acts for compensation. The streetwalker, also known as a prostitute, is the most visible sex worker. This is the person you see standing on the streets, going up to cars to offer their services. This individual usually charges about $20 for a quickie, which could entail a hand job or oral sex. They are also more likely to be arrested than any other sex worker, and in New York City, most women who are charged with prostitution are streetwalkers. So next I have some history of prostitution in the United States. So Philadelphia in the 1800s was a hotbed for prostitution and brothels, many of which were along the old waterfront area and in the South Street corridor. It was the center for white prostitution in the city at that time. In 1825 to 1857, about 50 New York City brothels were attacked. Women were viewed as either pure or whores, and rapes on prostitutes became a way for men to acquire privileges of manhood. In 1854 to 1856, merchants in New Orleans saw prostitution as a moral evil, and they composed an anti-harlotry campaign. They were known as the Know Nothing Crusaders. Then in 1865 to 1883, some prostitutes in St. Paul, Minnesota, claimed that they were legitimately employed in needle trades. In the 1880 census, two women with a history of managing brothels listed themselves as dressmakers, and the term plain sewing became a euphemism for prostitution, which I found particularly interesting. Here are some of the laws regarding prostitution. First up, in 1869, the Contagious Disease Act was passed, which required that female prostitutes have medical exams to stop the spread of STDs. In 1870, St. Louis was one of the first cities to enact a regulation ordinance regarding sex work. In the late 19th century, groups concerned with social morality crusaded against prostitution, leading some states to regulate and eventually ban prostitution. In 1910, Congress passed the Mann Act, which outlawed the transportation of individuals across state lines for the purpose of prostitution and ordered the deportation of undocumented immigrant sex workers. After attempts to regulate prostitution, the federal government enacted the Standard Vice Repression Act in 1919, which prohibited the buying and selling of sexual acts. Here are some state policies on prostitution. In 1971, Nevada decriminalized prostitution. 1990, the Boston Municipal Court did not charge any clients for patronizing a sex worker. Women prostitutes were typically charged more often than their male customers, which doesn't seem fair. Prior to 2009, there was no law in Rhode Island outlawing indoor prostitution, but that year a law was signed making prostitution anywhere in Rhode Island illegal. Up until the 21st century, Chicago police tolerated prostitution in certain areas until gentrification occurred. Today, 5 counties in Nevada allow prostitution, but only in licensed brothels and in counties with a population less than 700,000. So here I have some more state policies on prostitution. In 1994, San Francisco's Task Force on Prostitution was created, and after 18 months, the task force recommended that the city departments stop enforcing and prosecuting prostitution crimes and instead focus on the quality of life within impoverished neighborhoods. Some cities actually created prostitution-free zones. Like in 1995, Portland, Oregon banned known sex workers from certain areas. However, in 2007, the city removed the zones due to allegations of increased African American arrests. Currently, in Louisiana, people who solicit oral or anal sex can be prosecuted. And engaging in prostitution while knowing that one has HIV is a Class D felony in Kentucky, as it should be. So next, I'm going to talk a little bit about decriminalization. Decriminalization would eliminate criminal penalties for prostitution. Those against it have argued moral and public health concerns, such as the spread of disease and victimization of women. Feminist theories saw prostitutes as simply wage laborers and should have a right to do what they want with their own bodies. Legal efforts to achieve decriminalization have failed in the U.S. Most recently, in 2008, sex workers put Proposition K on the ballot to eliminate the power of police to enforce prostitution statutes against sex workers in San Francisco, California, but that proposition was defeated. Here are some of the risks of prostitution. Female prostitutes have the highest victimization rate of any set of women studied. A conservative estimate suggested that serial killers accounted for 35% of prostitute homicides. Furthermore, 2.7% of female homicide victims in the U.S. from 1982 to 2000 were prostitutes. And a UK study found that 81% of street workers had experienced violence from clients, compared with 48% who worked indoors. So clearly working on the street is far more dangerous. Empirical findings demonstrated that street prostitutes experience violence from other working women, men, the public, and pimps. They also ran into harassment from the communities where they worked and lived. Here are some more risks of prostitution. 1989 to 2002, in Birmingham, the women who worked the street reported 400 incidents of physical or sexual attacks by clients. In one study, 15 women were interviewed, 7 of which were raped, 14 beaten, 5 were robbed at knife point, 3 kidnapped, 3 robbed at gunpoint, and 2 were drugged. Street sex workers are among the most vulnerable in the sex industry due to robbery, rape, murder, arrest, criminal prosecution, and police harassment. Abuse from pimps and customers makes it difficult for female prostitutes to demand condom usage by clients, thus putting them at higher risk of contracting HIV or STDs. Women who experience objectification, sexual and emotional abuse, depression, PTSD, and other negative disorders. And according to the Council for Prostitution, female prostitutes are raped on average once a week. Here is one woman's account. I have been shot at, tied up to be stabbed, choked, was kidnapped for 3 days in the Hurley Hotel. I got tied up and stuffed in the trunk. It was about 12 to 13 hours, and when he did that, he purposely burnt me on my chest, branded me, so that's a scar I'll have for the rest of my life because of prostitution. I've been raped and all that, and they take the money back. They beat you in the head 50 times. They just keep hitting you, and they never stop. I had to put my head through windows to get out of the cars because the door won't open or the window won't roll down. So I literally had to throw myself through a car window and shatter it, to which I had stitches in my lip. For that, and it's just a lot of traumatic experience. I've got post-traumatic stress syndrome because of flashbacks. So that's a pretty horrific idea of kind of what prostitutes go through and how dangerous it is. So with all those risks, prostitution seems pretty dangerous. But some of these women and men have found ways to protect themselves. One way is by controlling the location. Sex workers reported feeling most vulnerable during negotiations with a client in his car. Therefore, the women create plans regarding the location of each stage of the transaction. They also must be aware of the physical layout of the location if they need to escape. They work away from dead-end roads or cul-de-sacs and work close enough to residential areas if they need to call for help. They also carry knives, blades, pepper spray, and lighters to be used as weapons. Others will even write down car license plate numbers of clients. And in one study, street prostitutes developed methods of monitoring, observing, and sharing information used by protesters to inform other street workers. Of 15 participants in a study, 8 female prostitutes had between 1 and 5 prosecutions. Others had between 20 and 30 arrests. The participants reported they would show compliance toward the police and develop working relationships with officers. The relationships were a trade-off for leniency in exchange for information regarding serious crimes. Here are some more survival strategies. Prostitutes can identify a bad date. So in one study, female prostitutes described a profile of a dangerous date. He is typically young, new to the area, and if he has attacked before, he may be in a different vehicle. The bad date is deceiving and acts like he is interested in honest exchange. He may even be quiet. In some cases, he rigs his car door so that it will not open or the windows cannot roll down. Most of the assaults occur in a location chosen by the client, usually out of earshot of others. Typically, he is not interested in sex, but rather in inflicting pain by beating or raping his victims. Other street workers rely on God to protect themselves. They view it as a coping mechanism and feel that it keeps them safe. And also dating regulars. This practice was viewed as risk-free regarding violence. Unfortunately, regulars were limited, and only about 50% were repeat clients. So it's not enough money to justify them dating regulars 100% of the time. So with all the risks associated with prostitution, primarily street work, why do people become prostitutes? Well, negative childhood experiences, for one, such as physical and sexual abuse, family problems, poverty, homelessness, exploitative men. Studies have also shown that 75 to 95% of women who entered prostitution was due to childhood sexual abuse. Sometimes it's to support a drug addiction, economic needs, lack of job skills and or poor education, limited employment opportunities, or coercion by a husband, lover, or friend who is already a prostitute. Next up, I have some information on male sex workers. Heterosexual men usually work for an escort service or in massage parlors. A gigolo is a man who typically provides companionship and sex to a wealthy woman. Men who sell their services exclusively to gay men usually work the streets and engage in sex in cars, homes, or other locations. Male street workers are sometimes called hustlers. So here are some gender differences in prostitution from a study of men, women, and transgenders presenting as female. So first, the authors looked at work schedules and earning, and they found that the women were more likely than men to have a regular work schedule, work more, spend less time with clients, and earn more. The transgenders were similar to the women. Then they looked at types of sexual services provided. The authors found that 70% of women provided hand jobs, 91% of men provided hand jobs. The women were more likely than men to provide a combination of oral sex and vaginal or anal intercourse. The transgenders and the women were similar, but transgender and men were more likely to give hand jobs and anal intercourse. Next, they looked at relating with customers. There were no major differences between women and men in conning a client. The transgenders were more willing to renege on agreed upon services. Then they looked at use of drugs and alcohol. Women were found to be more likely than men and transgenders to be involved in drug use. Next were occupational hazards. Women and transgenders were not significantly more likely than men to be beaten or robbed. However, the women were at much higher risk of being raped than men and transgenders. Women were also more likely than both to be arrested for prostitution. And finally, the authors looked at sexual enjoyment. The women were more likely to never enjoy giving clients hand jobs, having their breasts fondled, and providing oral sex. Women were also more likely than transgenders to never experience an orgasm. 7% of transgenders had orgasms, and 45% of men had orgasms. Overall, the men and transgenders experienced the most sexual enjoyment. Here is a brief overview of pimps. Many prostitutes have used pimps to provide protection against theft and violence, since they are unable to go to the police for help. The female prostitute may also support the pimp with her earnings in exchange for companionship, sex, shelter, clothing, and to bail her out of jail. However, the pimp may also engage in verbal, physical, and sexual abuse if the prostitute does not obey him. Interestingly, in one study, women reported that pimps forbade women from using crack cocaine in an attempt to control their financial interests. So here's a quick overview of Amsterdam's red light interest, or red light district. I found this part particularly interesting. So it's an international focal point regarding issues of morality and sexuality. In 1999, prostitution was made completely legal in Amsterdam. The city has progressive policies regarding squatting, drug use, prostitution, sexuality, gay rights, housing, and urban planning. Amsterdam has also been referred to as a gay capital of the world, and this gay community has helped to shape the red light district. The district is a major tourist attraction, often referred to as an adult theme park. Sex in the red light district is very visible, in which women stand in glass windows and doors offering their services. So this picture right here is actually one from Amsterdam's red light district. Kind of give you an idea of what that looks like. So the district also has bars, coffee shops to legally smoke marijuana, hotels, a sex museum, and plenty of sex shops. So here is a brief overview of a women's rights movement of the 1970s called Coyote, and that stands for Call Off Your Tired Old Ethics. So the movement was in favor of decriminalization of prostitution. The movement staged counter-degradation ceremonies such as hookers' balls, prostitutes conventions, and hookers film festivals, all of which celebrated prostitution. These events were designed to transform the self-image of prostitutes. Police and federal officials did little to change policies in response to Coyote. However, the movement did enhance the self-images of its prostitutes and won a few legal battles in courtrooms. The movement actually lasted for 17 years and managed to educate the public regarding injustices faced by prostitutes. So here are some clinical implications. The first part is assessment. To determine the therapeutic needs of sex workers, it is important to consider the causes and effects of prostitution. A sexual history should be addressed during the assessment, including questions about child sexual abuse and rape, substance abuse, and a full medical history. All clients who had a history of prostitution should be referred for STD and HIV testing, and the counselor should ask about any unwanted pregnancies or abortions. The woman may feel guilt, anger, shame, and depression about said abortion, which will need to be addressed. Since there is a high prevalence of child sexual abuse among female prostitutes, the client's experiences with these traumas needs to be addressed as well. It would be helpful for the counselor to utilize reflective listening skills and ask open-ended questions regarding the client's feelings towards sex and how the rape or abuse affected her sexual functioning. Next up, we have treatment. In the next stage, the counselor and client should work together to create treatment goals. Areas could include sexual healing, understanding the abuse and how their sexuality was impacted, creating a healthy sexual attitude, a positive sexual self-view, stopping negative sexual behaviors, and learning new skills for intimacy. Psychoeducational work is an important part of therapy for prostitutes. The therapist can actively teach the client about trauma and the mental and emotional effects of the trauma. Learning how traumatic events shape a client's worldview helps them to see how future behaviors are affected and can remove self-blame. Formal treatment related to trauma may begin once the therapist has determined that the client is safe and not using substances. Furthermore, the counselor needs to create a safe environment where the client can explore and heal from their trauma. For individuals who have been sexually abused, sex is a sensitive subject. So at the start of treatment, it is best that the counselor does not bring up sex to prevent the client from having flashbacks. The counselor needs to first establish rapport and trust. Here are some clinical implications and ways to conduct interventions. It is important to provide an explanation of interventions to give the client a choice. The counselor needs to begin with the least anxiety-provoking items and slowly work toward more emotionally intense therapeutic interventions. So meditation, deep muscle relaxation, and guided imagery are useful to help the client learn to lower stress reactions. These techniques will also help clients reconnect with their body and ground themselves in reality. Here are some coping skills. So once your client can regulate reactions, you can then help to create personal boundaries. The client should be encouraged to develop a support system outside of therapy. The counselor may need to teach the client what a healthy relationship looks like. The client will need to be taught coping skills to deal with negative reactions regarding the trauma. One technique is thought stopping. which involves having the client engage in a behavior such as snapping rubber bands like this when they're thinking about a negative thought, and then telling themselves to stop and replace that thought with a more positive thought. So next, the client and counselor can discuss feelings of shame, guilt, self-esteem, depression, anger, self-destructive behaviors, and concerns regarding trust. The counselor can also use cognitive behavioral techniques to help the client think of themselves as a survivor instead of a victim, and also work on improving negative sexual attitudes. So next up, we have sexual counseling. Once the client has dealt with the emotional repercussions of the abuse, counseling can focus on improving sexual relationships. Techniques include relearning touch techniques, sensual massage, initiating and declining sex, learning to communicate openly, and exploring intimacy. The client should also be taught communication skills such as I statements. Clients should be encouraged to pay attention to their thoughts, feelings, behaviors, and beliefs regarding sex and intimacy. Once the client feels ready, she can then move to sexual intercourse. So I learned a lot from doing this project, some of which I kind of already knew, and then other things I had assumed, but it was nice to have my assumptions reaffirmed. Like, I always wondered, why do women become prostitutes? Like, I always thought it was because of sexual trauma or abuse, but it was nice to read that in my research and have my thoughts reaffirmed. I also found reading about Amsterdam's red light district to be of particular interest. It kind of made me want to go there just to check it out, just to see. And I learned about Coyote, which I didn't know anything about. So it was really interesting to know that there was a women's rights movement primarily just about prostitution in the 70s. In a way, it kind of reminded me of the Me Too movement. So I found that interesting. And of course, learning how to treat someone who has been a prostitute was very helpful for me, because I have run across women who would prostitute themselves to get their drugs, and I never quite knew how to handle that, how like the right approach was. So it was, that part was probably the most helpful for me to kind of learn how do you counsel someone who has engaged in street prostitution. So that was probably the most helpful part for me. Thank you for watching my presentation on street prostitution. I apologize if it was a little long, but thank you for sticking with me through the end, and I hope you learned something. Bye!